Layla is getting ready to go home. Diagnosed with bipolar disorder, Layla has spent the last 4 months at Boodabika Hospital, Uganda's one and only national mental health hospital. Layla was one of over 900 patients recovering from mental illness in this 550-bed institution with a patient-staff ratio of 1 to 50. Overcrowded and understaffed in asylum-like conditions, Boodabika Hospital is often the final option for patients suffering from severe mental illness, after traditional methods and medicine, often associated with faith healers or witchcraft, have failed. Facing stigma, traditional beliefs and fear of mental illness, many patients who are ready to go home are abandoned by their families and left waiting for weeks, months and in some cases years at Boodabika's convalescent wards.
Convalescent ward is a ward where we get patients who have recovered, waiting to go home. We get stuck with them and we have to keep them.
YouBelong aims to increase the outflow of patients from Boodabika Hospital by assisting people living with severe mental illness to reconnect with family and community life and prevent relapse and return to the hospital. So how do we do this? By using a unique model of care that connects the patient back into family and community life while simultaneously addressing culture, beliefs and stigma. This comprehensive approach involves the entire community, its cultural and spiritual leaders, health workers and services, and the police, and addresses regular access to medication, education and income-generating activities. A multidisciplinary team of YouBelong social workers, occupational therapists and psychiatric nurses provides a culturally sensitive, family-focused recovery program. Using our own pre-discharge assessment tool, including family mapping, as well as our post-discharge empowerment strategy, YouBelong focuses on strengthening the family as an active agent for recovery. Furthermore, we include in our plan education of the local community in understanding mental illness, stigma and the path to recovery.
Twandibadde nga twekolamu omulimu singa tubadde tusudde omuntu nga mulwadde w'amatebwa mu kitundu kyaffe.
As it is, primary health centres and health workers at community level lack training and understanding of mental health. YouBelong is engaging with village health teams and local health centres to train and supervise them in mental health, as well as support the supply of essential medications to health centres.
Key to the YouBelongHOME model is that we work within the health systems framework. We're not trying to create parallel structures. We create supports that will enable patients with severe mental disorders continue with their recovery journey in their community and reduce their dependency on Boodabika Hospital.
In a further step, YouBelong advocates to government to build on our evaluated innovations in cost-effective ways and to embed them in government policy and services.
YouBelong is offering us an opportunity to formally apply this part of our policy of continued care by showing us how can we implement it.
This unique, sustainable, low-cost model of ongoing care of people with severe mental illness will assist in repositioning the health model in Uganda to integrate mental health care into its structures that are accessible in both urban and rural settings.
Era kati tumutwala ng'omuntu kati tetukyamutwala wali nti muki mulalu.
Obulwadde bugenda buwona.
Creating and implementing our unique model of community-based mental health care is something that we strongly believe can be replicated across the African continent.